Namaste, everybody, in the United States, in India, and all over the world. And welcome to this webinar hosted by the American Academy of Yoga and Meditation. My name is Akash, and I will be your host today. The American Academy of Yoga and Meditation is a nonprofit organization dedicated to promoting and spreading the philosophies of yoga and meditation derived from the ancient yogic texts. Through this month-long webinar series, we hope to inform as many people as possible about the unparalleled benefits that yoga has across the board of different aspects of medicine. Today, we will hear from some renowned speakers about how yoga can help us manage different types of pain in our bodies. All of us have experienced extreme pain, either due to illnesses or age or something like that. This can include chronic back pain, fibromyalgia, even joint pain. Currently, allopathic medicine cures or treats this pain, for short term, of course, with different medications. But these medications have very harmful side effects. They can cause neurological complications, psychological complications, nervous system issues, many different things like that. However, yoga has been proven to alleviate this pain without any negative side effects. Of course, yoga does it for a much longer period of time, though. This is what we will learn more about today in our webinar, Pain Management with Yoga. It is my honor to inform you all now that we have the opportunity to listen to some very accomplished speakers today. Our first speaker today is Dr. Devanshi Gupta, who runs a private practice in Texas. She has been recognized as one of America's top physicians by the Consumers Research Council of America. Another one of our speakers today is Dr. Darshan Mehta, who is the medical director of the Benson Henry Institute for Mind-Body Medicine at MGH. And he is also the site director for the practice of medical curriculum for all first-year medical students at Harvard University. Another one of our speakers today is Dr. Joyshri Subramaniam, who is the medical director and associate professor at the Health Sciences Center of the University of Oklahoma. Finally, our last speaker today is Ms. Wendy Hoon Langen, who is the associate program director for the Barry University Physician's Assistant Program. Now, I would like to take the time to introduce to you our moderator for this session today, Dr. Dinesh Patel. Dr. Patel is the chief of arthroscopic surgery at Massachusetts General Hospital, and he is also the associate clinical professor of orthopedic surgery at Harvard University. He has been awarded the John Clark Leadership Award and has also been named the commissioner of the National Committee on Foreign Medical Education and Accreditation. He has also received the Best New Immigrant Award by the Massachusetts Governor Weld in 2003. He has also been given the Gujarat Garima Award by the Prime Minister of India and the Chief Minister of Gujarat. Thank you all so much for coming once again, and I will now hand it over to Dr. Patel to introduce our speakers. Namaste.
Thank you, Akash. Thank you very so much. The Dr. Mehta could not come because of conflict, but we have three wonderful speakers which will accomplish the same objective, if not better. Can I have you present my slides, please? Today happens to be a wonderful day, June 19th. It was 1865 when President Abraham Lincoln signed Emancipation Day, Freedom Day, freedom from slavery, pain and suffering. It is national holiday today. We are also celebrating this week 21st International Yoga Day. But it reminds me of our Lord Patanjali. 200 or 500 years BC, he wrote these classics, Yoga Sutra, where he quotes in Sadhana Pada, 11.17. The cause of the pain is the association of identification of the Purusha and Prakriti. A remedy lies in that association. So the freedom from Prakriti and Purusha, disassociation, would help us relieve the pain, has been mentioned by Lord Patanjali, 200-500 years BC. Mind, body, spirit, self and spiritual realization. Can I have the next slide, please? AAM welcomes and wishes you the best. We invite you to participate in all the activities, and you're going to hear today yoga and pain management. Next one, please. Pain, when we talk about acute pain and chronic pain, most of the talks which we're going to talk about today are chronic musculoskeletal pain. Example being chronic back pain, fibromyalgia, other pains, different types of pain like headache, migraine. How can yoga help? Our three speakers and our sastras going to tell you different yoga techniques. Body, mind, and spirit. Can I have the next one, please? Lord Patanjali talks in Ashtanga Yoga. How can we use Ashtanga Yoga to relieve the pains, to get to the body, mind, and spirit? So yamas, niyama, asana, pranayama, pratyahara, dharana, and dhyama. These are some of the integral part of relieving the pain, as Lord Patanjali mentioned 200-500 years BC. Can I have the next slide, please? At the present, as we know, every corner of the city we have asanas and exercise program, yoga studio. But what we are going to say, what AAYN and our speakers are going to talk about, is it's not just asanas. We're going to talk body, mind, and spirit. How can we use Yoga Sutra to relieve that pain and dissociate from Prakriti and Purusha? Next one, please. We are extremely fortunate to have three speakers, and it's even more fortunate that we have all three speakers talking about very specific. Wendy, for example, is going to do at the grassroots. She's teaching students, she's teaching physical therapists, she's educating people who really perform these. Then we have Dr. Joshi, who is a interventional pain medicine person. Together with the knowledge in yoga, she's going to make a huge difference for us. And then Devanshi, who is going to talk about fibromyalgia and ultimately lead us to Kriya Yoga. So let us have our first speaker, Wendy. Wendy, to introduce her, is an associate professor of medical education and assistant program director for the Barry University Physician Assistant Program. Wonderful thing to do. These are the people who are going to help us in asanas and all the rest. We're doing it. Her clinical experience has been in cardiology and a family practice. She teaches physician assistant, massage therapists, promotes and practices healthy lifestyle, which includes exercise, yoga, and mindfulness. So, Wendy, the floor is yours. Let us begin from the grassroots. Can we have the next speaker?
Thank you. Thank you, Dr. Patel. I'm going to get organized here. Welcome, everyone. I'm so glad we're here. My name is Wendy Hoon-Langen. I think you know Dr. Dinesh Patel. He's our moderator. We'll be joined by Dr. Subramanian and Dr. Gupta as well. So glad to be here with you. I'm here to talk about back pain. As an introduction, it's very common. It's usually mechanical back pain, and it's caused by degenerative and progressive disease. As clinicians, we do diagnostics to rule it out, some emergent and operable causes, but in general, our management is conservative. It includes modification of activity and core strengthening. Chronic pain can lead to problems like inactivity and drug overuse. Movement is indicated for uncomplicated mechanical back pain. It's increasing as tolerated. We panelists all know and believe in the benefits of yoga and meditation for all things, but I'm going to talk a little bit more about the evidence for yoga and meditation for low back pain. The evidence is mounting. We'll talk about it some, but where we start, I want to start with a very good systematic review of the literature. It was done by Dr. Kramer in 2012. It's called Mindfulness-Based Stress Reduction for Low Back Pain. We also have a more recent publication by Dr. Basu Ray, a mechanistic model for yoga as preventive and therapeutic modality. So I'm going to talk about some more back pain studies, more recent ones. I'm covering mindfulness and yoga, and we find in general that more multi-phase studies are being done and more secondary analysis of these randomized controlled trials, which are considered the gold standard for evidence for a particular therapy. So many of these are being conducted in veterans institutions in the US because it has that benefit of having several different facilities where they can be studied. So some of these studies are planned and ongoing, and we'll talk about that good future positive model. Outcome measures are usually patient-reported established pain scales, which means that the patients in the studies are reporting improvements with yoga and meditation. This evidence is mixed, but we are finding some trends in the literature. Significantly, yoga is being compared to physical therapy, and there's much evidence for it for low back pain. We look at a recent review of yoga on clinical low back pain. It was conducted with this special way to do a review of many different studies. So the special way is systematic. It has a flow chart there that shows how different studies were chosen to contribute to this review. They concluded, based on all of these studies, that yoga did reduce short-term pain, and it equated movement therapy and its effect on disability. It's very positive results for yoga in that systematic review. I'm going to talk about some more reviews that are done more recently. Sorry, not reviews, clinical trials. These are the clinical trials for yoga that I'll cover. The first one, again, it was done in a military institution. It's still in trial, so there are no results yet, but it's comparing physical therapy and yoga in 320 veterans, and they're using the outcome measure, that pain scale. It's very common. We're all familiar with it. It is a way to measure pain, and it is a way to see if there are results in pain for certain therapies like yoga. Another study published in Physical Medicine by Joyce and other authors. It's another multi-center study, very good evidence, another randomized controlled trial. They studied secondary effects, and they find improvement in depression and anxiety with both physical therapy and yoga. In another study, it's another secondary analysis, which means a piggyback study on another study of low back pain. It shows really positive changes in perceived stress for patients with chronic low back pain. If you look at the graph, red line is the perceived stress of the participants that were in the yoga arm, and it's much better than the other two arms. In another study published in the International Journal of Yoga Therapy, 150 people were randomized to delay or yoga. So they both got the yoga therapy, and the ones who received the yoga therapy had significantly better results on their quality of life. And here's the quality of life scale there. You can see a big difference. Next, I'm going to talk about mindfulness meditation studies. These are the ones, some of them are ongoing. And we see this one, it's a pilot study, which means fewer participants, but it's in preparation for a larger study. This is on mindfulness and walking on chronic low back pain. And it shows outcomes and pain intensity, but not in sensory testing. I do like that they use that objective measure of sensory testing. And we do see positive outcomes in disability and pain intensity. In another multi-site in the military health system, there's a mindfulness study. It's currently in phase 2, and its outcomes are patient reported very positively. There are so many patients in this. We hope to see really good outcomes. In another multi-site, multi-phase study, almost 1,000 patients. It's including physical therapy, cognitive behavioral therapy, and mindfulness phases. This is a little pictorial of the different phases that that study will conduct. Another pilot study, which means a small study before a bigger one, is comparing 3 mindfulness practices on chronic low back pain. This one found mindfulness was acceptable, feasible, well tolerated with similar results across conditions. If you look at this, the specifics, it is actually exceeding opiate relief in its points, which is really positive results. So looking forward, just concluding this very brief literature review of the recent literature, we see several multi-site studies conducted in veterans institutions mostly. They're being published in pain journals and physical therapy journals, also all peer-reviewed journals. Many of them are secondary analysis of randomized controlled trials. Outcomes are mostly patient-reported and positive for both yoga and mindfulness. Going forward, I like to look at objective measures, so hopefully we can do some more sensory testing and make comparisons with movement therapies. I think this is a really positive trend in the medical literature that's showing objective proof that we already know as clinicians, as educators, and as practicers of yoga and meditation. We know these work, and we hope to see even more outcomes and recommendations for movement and meditation in the treatment of chronic low back pain. Thank you for your attention. I hope that we have a very good discussion of this.
Thank you, Wendy. Wonderful presentation. We're going to have a Q&A end of the session. The next speaker I'm going to invite is Dr. Joyshri Subramanian. Dr. Joyshri, the fact that
you may begin.
Namaste. Today's topic is...
Let me take 1 minute to introduce Dr. Joyshri. Dr. Joyshri, just the fact the name starts with joy means all the patients who enter, they know they are going out with joy, relieved by all the pain and sufferings. She is an interventional pain management specialist, been board certified in pain management, and received many awards in the field, specifically the awards in World Institute of Pain Medicine Fellowship, and she's a fellow of American Board of Interventional Pain Physicians and faculty in many academic institutions. Very distinguished career, and using all Western methodology like ultrasound, laparoscopy, stem cells. So we have a wonderful person who knows all about Western medicine, using Patanjali Yoga for pain management, and I will call Joy as a true doctor who is practicing integrative medicine, mind, body, and spirit to help the patient relieve their pain. So Joy, give us the joy and pleasure of your presentation so we can relieve all the pain.
Thank you for the kind introduction. Today's topic is pain management and yoga therapy. My name is Dr. Joyasree Subramanian. I'm a practicing pain management physician and anesthesiologist at Oklahoma University Health Science Center. Uh, this is a topic which is very prevalent, very widely discussed, and everybody experiences pain in one form or fashion during their lifetime. What is the relevance of yoga and pain management? If we go by the modified International Association of Society for Pain definition, which is defined as an unpleasant sensory and emotional experience associated with or resembling that associated with actual or potential tissue damage. Pain is actually a personal experience which is influenced to varying degrees by biological, psychological, and social factors. And a person's report of pain is through their life experiences. And pain usually serves as an adaptive role, may have adverse effects on function and social and psychological well-being. Now, if we take Swami Vivekananda's definition of yoga, it is an art, a science, and philosophy. It's a practical method for making one's life purposeful, useful, and noble. Yoga is a friend to those who embrace it sincerely and totally. It transforms the mind in tune with the essence, the soul, so they get blended. This is aptly applicable to whatever we have defined earlier. It all depends on how sincerely we embrace it. Yoga and chronic low back pain. Low back pain is a common cause of chronic pain in USA. $100 billion are spent in a year towards treating low back pain. 7.3% of the world population, 10% adults in the United States experience back pain. Yoga helps back pain by increasing physical activity, reduces a maladaptive posture and movement and relief of mental and physical stress. It can be practiced anywhere at home or a community setting. Increased levels of GABA have been demonstrated, as well as increased thickness of cortical gray matters in areas of brain associated with enhancing pain tolerance have been noted in studies. Common back pain like scoliosis, disc degeneration, lumbosacral transitional vertebrae, other musculoskeletal issues associated with back pain can be treated with yoga. Yoga and low back pain. Eric Grossel et al., he was a speaker last week and he spoke extensively about his study with chronic back pain, and we have evidence-based study to support yoga and low back pain. They conducted yoga classes for 12 weeks, twice a week, including physical posture, movement, and breathing techniques. And the patients showed at 12 weeks and at 6 months improved pain scores as well as less use of opioids. Another study in September 2020 by Zhu et al., they showed that there were 18 studies which showed the effectiveness of yoga and low back pain. They did a meta-analysis. They concluded yoga may decrease pain from short to intermediate term and improve functional disability compared with non-exercise. They were not sure whether it would improve physical and mental quality of life. Common yoga postures for back pain are Tadasana, warrior pose, lateral angle, triangle pose, or Trikonasana, knee or chest, or Apanasana. Before starting any yoga therapy, it is better to have a thorough physical exam with your physician and be under the care of a certified yoga therapist. Effect of yoga on chronic neck pain. Again, neck pain is the sixth leading cause of disability, and it's very frequent among adolescents, especially with more use of tablets, iPhones, iPads. It has been recommended as a complementary and integrative therapy for alleviation of various pain, including neck pain. There was one meta-analysis which showed that yoga had short-term effects on chronic neck pain. Zunzia Lee et al. Concluded that yoga can relieve neck pain intensity, increase cervical range of motion, improve pain-related disability, improve quality of life, and boost mood. But we need large-scale studies, randomized controlled studies to have better outcomes. Common yoga posture for neck pain are Vajrasana, Ardha Matsyendrasana, Cobra pose, or seated forward bend, etc. Again, better to have a thorough evaluation before starting yoga therapy under a certified yoga therapist. Yoga for headache. A headache causes disability, loss of work days, absenteeism. Common ones are migraine, tension type headache, cluster headaches, etc. 31 million Americans experience at least once in their lifetime headache. Dennis Anhire et al. Was again a speaker last weekend on chronic pain. They compared 4 randomized controlled studies where yoga was compared to usual care or none at all. Summary showed yoga can reduce headache frequency, duration, intensity in chronic and episodic headache. Post-intervention, the evidence was inconclusive, meaning after 6 to 8 weeks or 12 weeks of study, they were not able to conclude whether it was helpful. We need larger studies, high-quality trials, larger sample sizes to establish role of yoga in headache. Common yoga postures include the child pose, rabbit pose, Prasrita Padottasana, or wide leg forward fold, or seated forward bend. Again, you need to have all of the causes of headache evaluated, excluded before you start yoga therapy under a care of an instructor. Yoga for cancer pain, symptom management, and palliative care. Cancer patients can experience acute and chronic pain, chemotherapy-related side effect, radiation side effect, mucositis, neuropathy, etc. Yoga combines physical movement, breath control, and meditative components, very useful as part of multidisciplinary approach to reduce anxiety, improve sleep and mood disturbance, and quality of life. Sajita et al. In 2017, they compared 10 systematic reviews which suggested that there was short-term relief of anxiety, depression, fatigue, and perceived stress, and improved well-being. Positive effects were noted in reducing pain and lymphedema, but again, we need larger studies to establish long-term relief. Yoga for chronic non-malignant pain, study conducted by Casey Gray and Susan McCormack, published in 2019. They had 555 citations, of which there were 26 relevant reports that were reviewed. They included 2 systematic reviews, 6 evidence-based guidelines. One of the guidelines suggested use of yoga for low back pain. Again, Saxena et al. In 2017 concluded that 8 weeks of yoga showed significant decrease in VAS score, improves quality of life, better pain management, can reduce medication intake and their side effects in their study. Yoga for fibromyalgia and other joint pain. Fibromyalgia is a common ailment of the modern day. Widespread pain, sleep disturbance, fatigue, cognitive symptoms, reduced quality of life are all included in fibromyalgia. More common in women. Traditional yoga poses, when combined with pranayama, showed significant improvement in fibromyalgia symptoms, decreases pain, and improves quality of life. Yoga and rheumatoid arthritis improves physical and psychosocial symptoms related to the disease. It is very easily accessible and cost-effective for any type of arthritis or fibromyalgia. Conclusion: yoga has been shown to be very effective in the management of low back pain, neck pain, headaches, malignancy-related pain, both acute and chronic, fibromyalgia, different types of arthritis. Evidence-based literature is available, even though it is few, but it does help reduce pain, has been proved conclusively. Limitation includes smaller group of patients studied, difference in the intensity of the yoga practice, and the treatment designed in India versus elsewhere, variations in the type of yoga used in the study group, diverse group of instructor, etc. Studies found that positive results were reported 25 times more when it was done in India versus other parts of the world. Well-coordinated multi-center studies for various types of pain, especially in the lower socioeconomic group and diverse population, both short and long term, will help us use this very useful ancient mind-body science to help improve the quality of life of our patients. In future, we hope to do more multi-center studies to help improve the quality of life of patients with yoga therapy. These were the sources that I used to help design and do this talk along with my slides. Any questions, I would be happy to answer. Thank you all. Samasta Loka Sukhino Bhavantu. Thank you.
Thank you, George. It was a wonderful presentation, including the bibliography, which would help us read through and learn some more. The question answer we'll do at the end of all three sessions. The next speaker we have is Dr. Devanshi Gupta. Devanshi in Sanskrit says one who is endowed with all the beauty, serenity, and love of God. So we have that wonderful lady Devanshi going to talk to us on pain management with yoga. She has a wonderful CV. She's an active, passionate Kriya Yoga practitioner and Hamsa Acharya, who belongs to Siddhartha Yoga Parampara and a follower of Yoga Martand Sadhguru. He is an enlightened master of the great Nath Yoga tradition who do selfless service for the conscious evolution of mankind. He has instilled the spark of change after which her life has blossomed. Devanshi's life has blossomed. She is a devout meditator and is a self-testimony to the changes his transformational practice brings to one's life. Her journey after being found in grace by Guru has been to follow his mission of being. That is, meditated to furthering human awareness, dedicated to serving humanity and one's larger self, and devoted to earth's peace through all self-peace. She believes in the power of mind and has helped many patients practice dedication and discipline to change mindsets. She owes her success in mind strength to her Guru. More than that eastern part, in Western medicine, she has been a fellow American Academy of Neurology, American Association of Neuromuscular Electrodiagnostic Medicine, member of the AMA, Peripheral Nerve Society International Consortium, and on and on and on. She has authored many scientific papers, reflects her attention to neuropathic pain. Her work has been received in national and international conferences. So we see in Devanshi, like in Joshri and Wendy, a true Kriya Yogi, a really true Kriya Yogi. So let us welcome Devanshi and give us that special feel for how can we use yoga to relieve our pain and suffering. Devanshi, the floor is yours.
I thank the organizers and the volunteers of AAYM to provide this platform to present yoga and fibromyalgia. Here's a brief roadmap of today's talking points. Now, what is fibromyalgia? This is defined as a condition that amplifies the sense of pain perception by affecting the way the brain and spinal cord perceive painful and non-painful signals and is accompanied by fatigue, sleep disturbance, and cognitive dysfunction, besides potentially 40 other somatic symptoms listed in the diagnostic criteria. It is common for patients to suffer to the point that they can only focus their attention on pain. While there is no blood test that can diagnose this, current options for scientific proof and research include modalities like functional brain imaging, SPECT, EEGs, which are still in the preliminary stages of investigations and poorly understood. The reality of fibromyalgia is that getting started with any intervention is the most difficult part because many medically prescribed ways of treating are often without success and discouraging. This results in pain augmentation, maintenance, and a downward spiral of negativity, depression, etc. Life and pain seem out of control. Now, studies are being done on yoga, meditation, and other traditional schools of mind training in the treatment of chronic pain conditions like fibromyalgia. Reviewing the literature indicates an exponentially larger number of studies on the use of narcotics and opioids for pain, which today we know are not as effective, and overdose has become a leading cause of death. Treatment is multidisciplinary and must be approached with a determination to get better. This means changing lifestyles and maladaptive ways of thinking. So, why not yoga, which is not just asanas and pranayam, but rather the entire yoga philosophy, which can be better understood in the context of Ashtanga Yoga, the 8 limbs of Patanjali, and is a wholesome prescription for every aspect of treatment. The constructs of yoga render nothing impossible. Our first solution lies in the scientific and yogic principles of neuroplasticity and mindfulness. Neuroplasticity is defined as the ability of the mind to change habits, attitudes, and adapt as a result of experience. It is the principle of structurally and functionally rewiring the brain and a means to control the unbridled mind. This can be successfully embedded through mindfulness meditation. Mindfulness is a non reactive awareness of the present moment experience. Simple to advanced ways of practicing mindfulness are part of many traditional meditation styles and have been incorporated into effective programs like MBSR, now routinely recommended for this patient population. Mindfulness analgesia is now a much explored science that is believed to work on many different brain mechanisms in reducing pain. Several randomized controlled trials using fMRI, EEGs have been done to prove the sustained pain reduction and modulation to the point of self-control in patients with fibromyalgia who practice meditation, mindfulness, and self-awareness. We have gained insight into this by studying the brain of adepts in meditation from different traditional schools and control groups of non-meditators who gradually incorporated the practice. There are several remarkable studies done regarding this science. In the context of Zidane et al., 2 traditional forms of mindfulness practice, shamatha, which is mind tranquility, focused attention, and vipassana, which is open monitoring, were used. Even brief sessions produced reproducible and reliable improvement in experimentally induced and clinical pain. Brief mindfulness-based mental training of less than 10 hours of practice showed objective evidence of improvement in pain perception, intensity relief, and tolerance with engagement of unique reappraisal mechanisms. In less than a week, significantly increased dispositional mindfulness on average by 13% was noted, and reduced the unpleasant nature of pain by 57% and intensity of pain by 40%. Vipassana-based meditation produced significant pain unpleasantness reduction in the adept meditators when compared with novices. By contrast, mindfulness-based pain relief after extensive training greater than 1,000 hours of practice was associated with deactivation of brain centers that establish and maintain pain and a lower propensity to ruminate on and personalize the evolution of painful sensory events. Lutz et al. Tested practitioners of the Nyingma and Kagyu traditions of Tibetan Buddhism with more than 10,000 hours of practice Adept meditators exhibited less pain sensitivity and reduced fear-induced pain facilitation than controls. Attenuation, the expectations of impeding sensory events by sustaining attention in the present moment, is directly associated with improving mindfulness-based pain relief. Furthermore, the greater the meditative experience, the greater the self-control on pain. Brown and Jones used EEG and pain-evoking laser stimulation to examine behavioral and EEG pain responses in adept meditators. In the adept group, it was noted that trait-like pain modulatory changes can occur with extensive mindfulness training, even in a non-meditative state. Reduction in fear-conditioned pain, an increase in several endogenous neurotransmitters that are engaged in the mind cognitive modulation of pain and include cannabinoid, serotonin, dopamine, and opioid-based systems. In 2002, a Tibetan monk, Mingyur Rinpoche, came from Nepal to Wisconsin for scientists to test his brain while in meditation. fMRI studies were done and he was instructed to meditate on compassion, followed by a rest period. His brain centers for empathy rose 700 to 800 times higher than during rest periods. 21 Buddhist monks were subsequently formally tested with the same scientific protocol. Specifically designed EEG caps with 256 sensors were applied to his scalp. These adapts were found to have remarkable mental dexterity while generating compassion and laser-like focus, in addition to an ability to enter and leave meditative states, with a distinct neural signature of permanent transformation in the brain. All of them had elevated gamma oscillations, not just during meditation. Gamma is the fastest brain wave frequency and occurs when different brain regions fire in harmony, such as in moments of insight. The functional utility seems to be neuroplasticity and is seen in experienced meditations in different practices. For average people, gamma waves last only a fraction of a second. Gamma waves give the brain a sense of being in peak mental and physical condition and near perfection, which is to say, you can achieve anything you set your mind to. All these adepts in meditation tell us that anyone can train their brains to produce more gamma frequency. There are several studies that have specifically studied mindfulness training in fibromyalgia, as listed in this slide. Grossman et al.'s experimental study examined effects of an 8-week mindfulness-based stress reduction intervention among female patients with fibromyalgia who underwent MBSR. Pre- and post-intervention analysis indicated MBSR to provide significantly greater benefits than the control intervention in visual analog pain, quality of life subscales, coping with pain, anxiety, depression, and somatic complaints. 3-year follow-up analysis of MBSR participants indicated sustained benefits for the same measures. There are several studies besides this which are listed in the slide and specifically investigate mindfulness in fibromyalgia. The goal is to achieve habitual trait mindfulness meditation. Motion is lotion. There are several randomized controlled trials which focus on different forms of exercise, physiotherapy, water-based exercise, electrotherapy, massage, kinesiotherapy, which effectively reduce pain. Practical advice based on patient care dictates not to begin with standing poses. Begin on the mat, laying down. Start with body awareness, alignment, then advance to all fours, quite like I have shown you in this slide. Depending on the person, it will take weeks to months before you graduate to standing poses because you have to build enough strength, alignment, and body awareness to be ready for them. There have been several studies, as listed in this slide, that explain the impact of daily yoga based exercises in fibromyalgia. How about spirituality? These are a few examples of great yogis and enlightened beings who were born with severe pain, adopted pain as noted in the arm, which has been kept upright for 38 years, and a healer of people in severe pain when he himself suffered pain all his life. Though we have focused on yoga's ability to cognitively and physically improve the life of fibromyalgia patients, there is a deeper aspect of yoga which relies on inner introspection and going beyond one's mind to universal consciousness of pure awareness. Humans live in a dichotomy of subject object distinctions. Yoga points to the possibility that this duality may be transcended in special states of non dual awareness. This is a state of consciousness that is unified, empty of mental content, immutable yet retains a quality of cognizant bliss. This field of awareness is not recognized, though it is ever present, obscured by our discursive thoughts, emotion, and perception. It is characterized by experiences in which the self and world are merged into a unified whole, or the boundaries of the self dissolve into an emptiness. This facilitates fundamental insights into the nature of reality and the emptiness of the self. Such insights produce profound states of bliss and promote a long lasting sense of well being. In contrast, being unaware of this truth is believed to contribute to suffering. Practice of mindfulness meditation may evoke transient states of self transcendence that fluctuate in intensity throughout the meditation session, deepening with elongated practice sessions and greater meditation expertise. The advancing practitioner can use this mind power to heal the body and relieve its suffering. It is tragic to think of people who endure years and years of pain. Man's susceptibility to suffering comes through ignorance of his innate divinity. While it is easy to neglect the long and arduous process of developing control over the mind and the body, many people who do uphold the proper discipline and sincerity are able to reap the rewards of mind control, which unlocks the potential of self realization and receiving the ultimate form of inner introspection. By controlling the mind, one can become indifferent to the condition of the body in health as well as disease, even as a person under an anesthetic can be operated on without feeling any pain. The germ of every trouble starts in the mind, yet in that mind is also the infinite power that most people have never used. The universe responds to your frequency. It doesn't recognize your personal desires, wants, or needs. It only understands the frequency at which you are vibrating. If you are vibrating at the frequency of pain, depression, anxiety, you will attract things of a similar vibration. If you are vibrating in the frequency of love, joy, and abundance, you attract just that. It's like tuning into a radio station. You tune your energy into the energy you want to manifest. Thank you for having me again. And remember, change your mindset, change your life.
Thank you so much. This was a wonderful presentation, Devanshi. I enjoyed thoroughly. You have added some scientific proof of Western modalities that we can convince the Western group of people about the value of yoga. So this wonderful presentation, and I admire you for doing it. What we're going to do is to now get some questions and answers. To all my good speakers, please get ready. You're going to be asked wonderful questions. So let me start first question. This is about someone asking about how to manage hip pain and back pain. So I would start being an orthopedic surgeon to begin with. And then, as Joyce mentioned before, that you really need to look at the patient first to make sure you don't push hip or don't push back till you know whether or not he or she has arthritis or a small undisplaced fracture, or there is nothing in the back like a tumor or whatever. So once you rule this out, I think we will have a three wonderful group of people who can respond one at a time. So when they tell me what would you do, then we will ask Devanshi and Joshi, all three of you, because these are common problems. Back pain is not an uncommon problem, very common problem. So it'd be good for us to know from all three of you, see how you will deal with the patient who is referred to you for hip and back pain.
It's an excellent question, and it's a very common affliction. So first, as Dr. Dinesh said, we must rule out alarming causes. So as an orthopedic surgeon, he knows that he looks for operable causes. We do physical exams to make sure that there may not be a neurological problem, possibly cancer, or alarming causes of infection. So once those alarming causes are ruled out and we establish that this is mechanical back pain, which is the most common, the conservative measures are what we use. So we start with gradually increasing movement. Remember, inactivity is not indicated for low back pain. That said, we give doctor's notes for any laborer or someone who is doing something in their work that exacerbates the pain. So don't do what hurts, but do move. Start to move slowly. Getting into a swimming pool is very helpful. And then increase the movement as tolerated using yoga. As Dr. Gupta says, sometimes the 4 yoga poses are the best to start with, going gradually to the all fours, and then finally the standing poses. That said, also increasing your movement and then awareness long term is helpful. Increasing core strength will prevent episodes of low back pain. So using the yoga poses to enhance the core strength will definitely prevent the future episodes of the back pain. Thank you.
So next, I will ask Joyshri. Joyshri, you are an interventional pain management person. Would you think, is there any role for a patient with acute back pain or hip pain with a steroid injection under fluoroscopy before you institute the line of management of asanas and all? Or should we do the other thing first and then come back to intervention pain management? I think this is not an uncommon issue where patients doctors see this chronic back pain. At what stage of the game would you think you will add this interventional type of management?
Good question. Usually, when we see patients in a chronic pain setting, they have already been through physical therapy, chiropractor, had medications, and sometimes, they've had multiple surgeries or no surgery, and then they come to us. So it varies at what stage do you see the patient. If we catch them earlier on, then we go ahead and start with therapy if they haven't done. And in my practice, I tell them the 50% of my work is done by the injection to get them to where they can exercise more. So patients have to understand that they have to take charge of their care. And sooner they get into a regimen of abdominal back strengthening or water therapy or combining it with some mindfulness, they are better. So it varies. Again, it depends on what the patient has done before and what we can offer. If they haven't had therapy, I start with therapy first.
Thank you, Joshi. Let me ask Devanshi. Devanshi, as we know, the back pain has got a multiple causes. It could be from emotional to work related, as Wendy said, to multiple surgery in the past. So, what stage of the game do you think we need to make them comfortable enough that the back pain is not end of the game? We're going to start something unique, mind, body, and spirit. So they will get stimulated that there is some end of the tunnel available. So what would you do? Now she has seen Wendy, she has seen Joshua. Now they patient the back pain, because they're not better, they have to go back and forth a number of places. So what would you advise those patients who either initially or who have come after going through Ashtanga yoga or interventional medicine and then comes to you? Unmute for you. Can you unmute it?
Thank you, Dr. Patel. And I totally agree with Wendy and Dr. Joyshri. We all start with very conservative measures. And I am big about, actually, I end up seeing patients really at the very end after they've seen the pain specialist also. And they're just hoping that something will work. And, here they've received, as Dr. Joyshri and Wendy will agree, they've done everything possible. They've been on every medicine possible. They just don't know how to live anymore. It's just pain. And their whole focus is pain. So in that situation, seeing this over and over again, I realized that first of all, I recommend that they internalize this to understand that it has been built up by whatever has been going on. For instance, today everybody is in a sitting posture before a device for unbelievable number of hours. And then their hands and everything is this. So it's very sad that even young people come with such problems and they are in chronic pain by the time they seek help for it, literally. So I like to tell them that this is, first of all, work on your posture, work on core and back strengthening. And I definitely guide them towards mindfulness, which is a very big tool in making patients better, actually. I just sit with them and teach them how to breathe right to start with. And it's very effective. People don't breathe, just without doing anything, but in pain, they breathe even shallow. So it's very sad that they can't even catch their breath. So it's nice when I teach them just simple, mindful practices, like how to focus on their breath. And with that, I will kind of guide them a little more that maybe you want to make your exhale a bit longer than your inhale, because by doing that, you are actually combating your fight, flight, freeze system completely, and you're activating your vagus nerve. And there's a very prevalent theory nowadays about polyvagal everything. So I just want you to know that you can do this 24/7. You don't have to do it in front of somebody, learn it somewhere specially. Just focus on your breath. Now, you can definitely, and then I do recommend that, patients like this go and get more insight into ways of doing better meditation. And I certainly see very good results with that. In addition, I make them do exercises in water, just like my colleagues just said, because that also helps them tremendously. But seeing patients over 20 years, I do want you to know that people who did follow the practice of, first mindfulness, they noticed great improvement, not just in their pain, but also in the way they were living. They started living. They were very happy with this intervention, and most of all, when they had a flare, it came in most handy because those are the times, they slip. They can't go further. So there are enormous number of studies now indicating that, we should never get our lifestyles to the point where pain affects us, first of all. Prevention is always better than cure. But when you are there already, definitely interventions like our Ashtanga Yoga provides a wholesome prescription from beginning to end. And I really like them to focus on mindfulness because then they are able to reduce all other distractions in their life to realize that they have much more to accomplish with a calm mind. And the more calm the mind is, the better their control on pain also.
All of you, I was very thrilled to see that you are starting with asanas and pranayama as a way to manage this chronic back pain. But the patients are asking, what is yoga? What is meditation? How do I do meditation? You are using these buzzwords of meditation, mindfulness, but all I get is asanas and maybe pranayama. So could you explain a little bit more about dharana and dhyana as part of Ashtanga Yoga in helping patients with a chronic back pain or headaches or whatever. So let us start again from Wendy to Joyshri to Devanshi. Wendy, would you be able to advise your patients about what to do? I'm tired. I got this. I gone through this, and all the buzzwords cooking. Then let's do meditation. Let's do mindfulness. But what is it? Help me. I want to do it. So let us start from Wendy and Joy and Devanshi.
So that's a good question. And I think that you can also go to what is pain? And pain is something that people experience, but it is also mind-body process. And we cannot address it without addressing the mind and the body. And so I'm going to defer to my colleagues now and say that pain is complex, and it deserves a complex response, and a response that involves an awareness and an acknowledgement of the pain, and then a way through it, and sometimes into it. Thank you.
Joshua, can I get a comment from you?
Sure. I think pain is very complex, like Wendy mentioned. These are the days of instant gratification. We have all forgotten basic of taking care of ourselves, giving ourselves a little time. We are all on the run, and so instead of using buzzwords like yoga or meditation, I simply teach them that you are just taking a deep breath through the nose, ask them to hold, show them basic pranayama, whether I see them for back, neck, headache, cancer pain, whatever it may be. And I tell them and show them simple stretches that is relevant to their pain, because majority of it is mechanical, maladaptive posture, and something like a bad habit that we have developed over many years. So just showing them some of this, some of them will say, is this yoga? Is this stretching? I tell them, yes, it is a form of stretching. And I don't leave any patient leave my office without listening about the importance of deep breathing and movement and stretching, because I think in modern medicine we all want to prescribe, inject, do something more and more, and do not emphasize the importance of going back to the patient himself. What is it that they can correct so that the pain can be reduced? So I think we all need to involve the patients more in their care. Thank you.
Thank you, Joshri. The patient is in the waiting room with his wife. He comes out and say, "Gee, Asha, I got a good consult from Wendy. I got a wonderful consult from Joshri, but I'm really not sure. I've gone through all of these, and I'm having this pain. They're telling me to do this, that, this, that. How am I going to do it? I need something more. I really need someone to calm me down, maybe focus me or something, get me to focus what I got, my job, my children's, my work. I cannot focus it. So, Joshi, would you mind if I get another consult?" The Joshi, as good she is, she says, "Of course. Why don't I refer you to Devanshi?" So here, patient comes to Devanshi. So Devanshi, please tell us what more can we do? We've done asana, we've done a pranayama, we have gone through a close communication with them, give them a sense of confidence. But I got to work, I got to feed my kiddos, and I got to play with my grandkids, and I still got the pain. Help me. So help me, Devanshi. How would you treat me?
So I would actually tell Usha that, Usha, you have the remedy. I don't. And you have to tap into your own system of calm, which all of us have. We just get very far from it today in our life, in our lifestyles, with so much sensory input. I don't know what all we keep doing all the time. I want you to know that when you tell the patients that they hold the key to getting better and they have to tap into their system of calm, they will make everything better, not just pain. So that is what I mean by a mindset. You have, and nobody has direction. We all say, okay, go do yoga, meditation. We show them a few things. This is a good start. This is a very good start. But when and don't forget, you have wired yourself in such a way by the time you have come for such simple help that it will take you time to get better. You have to be kind to yourself. You have to be patient. And that is why I said, start with your breath, mind your breath. Because if you look into the very traditional system of Patanjali yoga, you can follow all of that, but you don't have to do anything fancy. 24/7, just start by focusing on your breath. And in fact, make it a goal. It's biofeedback to see how can you slow down your breath, because that is preliminary for mindfulness and for meditation. And then, in fact, I'll ask my patients, okay, you practice 5 minutes in the morning and then 5 minutes every hour. And whenever you're in pain, do it again. So they can't believe it initially, but when they try it, they start seeing the benefit. They will bring me objective evidence of showing me how they have started reducing their breath or the rate at which they are breathing, and other very nice changes, which are all about fight, fright, freeze. These poor people live in that mode all the time. So the more you tell them about calming and practicing, and this is not, it doesn't need training. Just keep slowing your breath. Keep working on it. Keep doing it. And talk to adept meditators. We know from our yoga that they can even stop breathing. They don't need anything. You are in such a state of disconnect from your body and mind that you don't need analgesia. In fact, the last 3 slides I showed, I want to re-emphasize on them. The first one was Rishi Ashtavakra, who was born with many, many body deformities at 8 parts of his body. The second was about this man, Amar something, and he has kept his arm lifted for the last 38 years in just to get to that state of mind, because he wants to control his mind. Isn't that amazing that Indians even do such things? But he is not in pain. Ask him, he is in bliss. And the third person is San Severino Pacifico of the Catholic Church. It is very interesting that he was born with pain. He had even more pain during his life, many hardships. But he actually became the saint of chronic pain. Now, I'm just giving a very broad picture here. But what I'm saying is you have to start somewhere. And I think if you start with the mind, if you start by calming the mind with mindfulness, because the only tool you have at that point to start in such panic is your breath. So you want to focus on your breath definitely to start with. And gradually, when you realize that breath is controlling some of your mind, then advance to laying down flat, aligning your body, getting things in order so you can bear the strength of even standing and doing poses. Once you get there, incorporate everything. Now you are coming to your, to the basics again. You want just everything that will heal you. It's late in the day, but you start working to heal yourself. I think that is what works best. And this is not a joke. The more you meditate, the better you get at it. And then all things kind of just get better and better. It's not just about anxiety, depression, and so forth. Your creativity peaks. Your acceptance for pain is so high that after 4 years of doing deep breathing, if my patient comes back and I ask them, what do you do today? They say, doctor, I don't even need my spinal stimulator. I don't need my crutch anymore. I don't need my walker. I just breathe. That's proof. And I tell them, you breathe deeper, keep watching your breath and keep focusing. You cannot control the mind. That is the kind of meditation I practice, which is Kriya. But just by having an awareness of what you are thinking and what are you paying attention to, you will see that you can change the way everything is in your life. That is mindfulness too. So ask yourself, what are you doing? What are you focusing on? That's your vibration. If you are focusing on pain, you will vibrate with pain. You will attract more pain. You stop doing that. You change your mindset. Start being very positive about everything. Say, okay, it's a journey. I have decided I am not going to live with it. I promise you will get better. And the thing is, it's a slow process. You took so many years to get to so much pain. Give yourself time to get out of pain and make it a lifestyle. Nobody likes to take a U-turn after they've made that change in their lifestyle and they've incorporated very powerful things like meditation. Now, to answer your question about dhyan, dharana, pratyahara and all, those are much later in the process. Okay. But remember, when you keep doing it, you get there. You automatically start having some experiences, which is very, very motivating for you. You become your own doctor, you want more. I want to give you another instance here. Some of my patients feel compelled to tell me what happens when they...
Devanshi, don't want to interrupt you, but the patient in the waiting room is getting impatient. They want to... she comes out and says, Asha, I have heard all of these before. I've gone to YouTube's. I've gone to all of this stuff, apart from Joshi, Devanshi, Wendy, but my mind is continuously wavering. I need a structure program who has enough time to spend with me and maybe find a center. So I think we have wonderful discussions about how we manage the back pain by a yoga type of thing, but we need to go one step further. That is what I think AAYM is planning to do, is to educate the masses, one, as well as open up some centers where they can go and relatively learn and practice. Right now, they go to doctor's office. I give 15 minutes advice, do this, do this, do this, do this, do this. He goes home and he forgot what to do now. So we need one step further to follow this master of art, this yoga, ashtanga, to relieve the pain. And I would say it would be a good idea for us to promote those centers where Joshi and Devanshi and Wendy can refer patients who can, with patiently, either in a joint therapy or something, spend enough time to take away those extra tensions, which increases the pain and reduces this association of Prakriti and Prana, Prakriti and Purusha. By relieving that, I think we're going to be able to relieve a lot of pain. Anyhow, wonderful discussions. I really enjoyed myself, learned a lot. The time is short. I see my young man Akash is eagerly waiting. So, can I have my last slide, please? Akash, can I have my last slide?
Yes.
So, let me thank not just Devanshi, Joshi, Wendy, but all the registrants who took the trouble to listen to these wonderful speakers. I especially need to thank my good friend Indranil and AM leadership for really making this very practical, easy for the entire week for International Yoga Day. And my real special thanks who really at grassroots have made a huge difference. Anjali day and night from India, Raghu Bharadwaj, Rupa, my dear lady, who calls back within a second, and youngsters Akash and Sagasagar. So thank you all so much, and let's keep plugging away. Let people know that there is something unique. It's 400 years BC, Lord Patanjali gave this Yoga Sutra, which we can help in modern times to relieve the pain by yoga, mind, and spiritual realism. Thank you all. And Akash, you have something to say. So, podium is to you.
Thank you so much, Doctor. Thank you so much. What an informative webinar we had today. Miss Langan, what great evidence you presented. You really showed us that yoga and meditation are being practiced and being proven effective in so many different situations. Dr. Subramaniam, I love the way you spoke about how chronic low back pain, neck pain, headache, and many different types of pain can be alleviated with yoga and meditation. It's amazing to know how yoga can help decrease symptoms in even major diseases such as cancer. Dr. Gupta, you talked about how effective yoga is for such widespread illnesses like fibromyalgia. I loved your saying, motion is lotion, to show how specific yoga poses, when done in a proper manner, can be extremely helpful for many, if not all, illnesses. And same as breathing, it is so helpful for every scenario. Lastly, Dr. Patel, thank you so much for your wonderful moderation. The way you fluidly transferred from one speaker to another was amazing. It was amazing. We all enjoyed thoroughly, didn't we? On behalf of AIM and all of our viewers around the world, thank you so much to Dr. Joyshri, Dr. Gupta, Ms. Langan, and Dr. Patel for teaching us so much about the different aspects of pain management as they apply to yoga. Again, Dr. Mehta was unable to be here due to some difficulties, but we hope to have him for a talk later on. I would also like to thank the tech team, Anjali ji and Sagar ji, without whom this webinar would have been impossible. Sagar ji actually hosted a webinar right before this one, but he came running for this webinar. Our next event for our viewers is a session on advanced postural yoga by the very skilled Sri Ram Sarvottam on June 19th at 7:30 p.m. Central Standard Time and June 20th at 6 a.m. Indian Standard Time. Please visit our AAYM website for more details. Thank you so much for attending this webinar. Good morning, good afternoon, and good night to all our viewers all around the world. See you all very, very soon. Namaste.